You know that feeling? Chest tightening, finding it hard to get a full breath, where simple things just feel like, way too much effort.
Mm-hmm.
We've all felt something like that.
Yes.
But for those in our asthma friend community, folks managing asthma day to day, imagine that feeling amplified by other health issues.
Exactly. That's what we're digging into today.
Right. Because asthma, it doesn't happen in isolation, does it?
Not at all.
No.
It's really, tangled up with so many other parts of our health. And for everyone listening in the asthma friend community, understanding these links is just so important for, well, for better management.
Okay, so we've gathered quite a bit of information for this deep dive. We've got articles looking at high blood pressure and asthma,
Hmm.
how city living affects us, the connection between mental health and breathing,
And even workplace stress, which often gets overlooked.
definitely. And our main goal here, especially for you, our asthma friend listeners, is to pull out the really crucial stuff from all this.
Yeah, we want to offer some practical tips, give a clearer picture of how all these different things can play into your asthma experience.
Okay, let's dive right in then. First up, uh, high blood pressure, hypertension, and asthma. They seem separate, but what's the actual connection?
Well, it's fascinating, really. These two conditions, they can sort of feed off each other. Like, if your heart and blood vessels are already working harder because of high blood pressure,
Right.
then an asthma attack puts even more strain on the system. And that can manifest as, chest pain, maybe palpitations, feeling dizzy.
Wow. Okay. That's definitely something for our community to keep in mind.
It really is. And there's more. Sometimes high blood pressure leads to the body holding on to extra fluid.
Okay.
If that fluid builds up, it can actually make your lungs feel heavier, more congested, which can worsen asthma symptoms
Hmm.
like that breathlessness or wheezing.
So it's not just like having two separate problems at once.
Yeah,
There's a real biological overlap, isn't there? You mentioned inflammation.
precisely. Chronic inflammation is kind of a background player in both asthma and hypertension. So if your body's already dealing with inflammation from one,
The other can make it worse.
exactly, it just adds fuel to the fire. And then there's stress. Emotional stress is a known trigger for both high blood pressure and asthma flare-ups. It's a shared vulnerability.
You mentioned a silent danger earlier. What did you mean by that?
Well, like asthma sometimes, high blood pressure often doesn't shout about itself. You might not have obvious symptoms until it's pretty serious.
Right.
So if you have both, and maybe you're unaware of the high blood pressure, they can both be quietly chipping away at your health. It just really underlines why regular checkups are so vital, especially if you have risk factors.
That brings us to medication. Many in the asthma friend community rely on meds. What about interactions between asthma drugs and blood pressure drugs? That sounds potentially tricky.
It is a critical point. Some blood pressure meds, specifically a group called beta blockers, can unfortunately cause bronchospasm in some people with asthma.
Making it harder to breathe.
Exactly. And then flipping it around, long-term use of steroids, which are common for controlling asthma,
Yeah.
can sometimes raise blood pressure. They can also cause weight gain and fluid retention, which obviously doesn't help if you're also managing hypertension.
And even simple things like decongestants.
Good point. Even over-the-counter decongestants can bump up your blood pressure and might interfere with how well your asthma is controlled.
So the absolute key takeaway for listeners here is
Always tell your doctor you have both asthma and high blood pressure before starting any new medication, even over-the-counter stuff.
don't assume anything is okay.
Right. That way, your doctor can choose the safest and best treatments for your specific situation.
That's such important advice. Okay, so how would someone listening know if they should be extra vigilant about monitoring both conditions? Are there warning signs?
Yeah, there are a few things to look out for. Maybe you're having more frequent asthma attacks than usual, or perhaps you're getting headaches, feeling tired or dizzy without a clear reason. Those could be signals. Age is also a factor. If you're over 40, especially with a family history of high blood pressure, regular checks are just smart. And like we said, if you notice your asthma gets worse when you're stressed,
That's another flag.
definitely another reason to keep an eye on both blood pressure and asthma control.
Right, being aware of those patterns.
Yeah.
Now let's shift to the positive. What can we do? Our sources mentioned lifestyle changes that help both. What are some of the big ones?
This is where it gets really encouraging because a lot of the advice works for both conditions.
Yeah.
Cutting down on sodium, salt,
Yeah.
that directly helps lower blood pressure. And there's even some evidence it might positively impact lung function too.
Interesting.
Staying hydrated is huge. Drinking enough water helps thin mucus, making it easier to clear from your airways, and it's good for circulation overall. And sleep. Don't underestimate getting 7 to 8 hours. It's crucial for regulating blood pressure and reducing asthma triggers.
Makes total sense. What about things like breathing exercises? People talk about those for stress?
Absolutely. Techniques like deep belly breathing or annulum velam, that's alternate nostril breathing, and pursed lip breathing are fantastic.
How do they help?
They help calm the nervous system, reduce stress, improve oxygen flow, all beneficial for both asthma and hypertension. And exercise. Gentle stuff like walking, swimming, yoga, usually great
But
options.
check with your doctor first.
Always. Especially before jumping into anything high impact, you need personalized advice.
One source shared a really powerful personal story, someone managing asthma and high blood pressure, but with only one kidney. They talked about how stress and even steroid use affected their blood sugar.
It's a perfect example of how interconnected everything is in our bodies.
Yeah.
And the main message here for everyone in the asthma friend community is that asthma and hypertension often go hand in hand. You really need to manage them together, think about them together.
You can't just focus on one and ignore the other.
Exactly right.
Okay, so we've covered those internal connections. Let's pivot now to the outside world. The idea that your environment matters. How does city living, things like heat and noise, impact people managing asthma?
This is such a relevant topic for so many in the asthma friend community, especially those in urban areas. Think about noise pollution, traffic, construction, sirens.
Constant background noise for many.
Right. And our sources show this constant noise can actually increase cortisol, that stress hormone.
Which we know affects blood pressure.
Exactly. And it can mess with your breathing patterns too, potentially even triggering asthma. There's research linking chronic noise to hypertension and poor sleep. And poor sleep, as we just said, is another asthma risk factor.
Just like your body's always slightly on edge. And what about city heat? Heat waves seem more common now.
Yeah, urban heat is a big one. Extreme heat can trigger inflammatory responses, which can narrow airways and lead to more asthma flare-ups. And for blood pressure, heat can cause dehydration and mess with electrolytes, making it harder to keep BP stable. Plus, there's that tricky situation for some asthma folks where AC helps with heat, but irritates their airways.
That's a really tough balance. And just the general stress of city life, crowded commutes, maybe lack of green space. I know I feel it sometimes.
Absolutely. That constant low-level stress of navigating a busy city can definitely raise blood pressure and fuel anxiety.
Which worsens asthma.
Exactly. We saw one insight about how specific things, like heaters on the metro, could be a trigger, but then taking the bus meant exposure to traffic fumes. It's these daily environmental negotiations.
So what can listeners in cities actually do? It feels a bit overwhelming.
There are things you can control. Noise-canceling headphones or earplugs can make a difference, especially on commutes.
Okay.
Checking the air quality index, the AQI, and the heat index daily helps you plan. Maybe you exercise outdoors early morning or later evening when it's cooler and less polluted.
Smart. What about at home?
Good home strategies are key. Using fans, ensuring good ventilation, maybe investing in an air purifier, and definitely keeping AC filters clean. And hydration, again, is super important in the heat.
And maybe creating a calm space.
Yes, having a safe breathing zone at home, somewhere cool, quiet, maybe with cleaner air, can be a real refuge.
Those are great practical tips. It's about managing your personal bubble within the bigger city environment.
Precisely. You can't change the city overnight, but you can understand its impact and make choices to protect your health.
Okay, now let's shift focus to something really crucial, especially as some sources mentioned, Mental Health Awareness Week, the asthma-anxiety connection. This feels very real for many in the asthma friend community.
Oh, absolutely. Living with a chronic condition like asthma carries a significant emotional weight. Just the feeling of being short of breath can spark panic.
Yeah, I can imagine.
And the memory of past severe attacks. That can create this anticipatory anxiety, constantly worrying about the next one. Plus, lifestyle limitations because of asthma can lead to stress and frustration. And sometimes, even the medications themselves can have side effects that affect mood.
It's a complex loop. One story shared was about having a panic attack during an asthma flare-up. How do you even tell what's what?
That's such a common and frightening experience. Learning to manage both the physical symptoms and the emotional response is key. Our sources had some good strategies here.
Like what?
Having a clear, written asthma action plan. Knowing exactly what steps to take can reduce that feeling of panic, give you a sense of control.
Right.
And practicing those breathing exercises we mentioned earlier, pursed lip, box breathing, maybe looking into the Buteyko method, which specifically targets hyperventilation.
So,
These can calm both your breathing and your mind.
what else?
Keeping a journal, tracking symptoms and emotions. You might start seeing patterns, identifying specific triggers for both asthma and anxiety.
That makes sense. What about getting outside help?
Therapy can be incredibly helpful. Cognitive behavioral therapy, or CBT, is often recommended for managing anxiety linked to health conditions.
Okay.
Also, finding mindful movement you enjoy, like yoga, keeping environmental triggers in mind, of course, and crucially, building a support system, talking to loved ones and connecting with others who get it, like in asthma support groups or our asthma friend community online. That shared experience is powerful.
When should someone think, okay, I need professional help for this anxiety?
Good question. If you find you're constantly worrying about attacks, if you're avoiding activities you used to enjoy because you're scared, if anxiety's messing with your sleep, or if you have that persistent chest tightness even when your asthma should be under control,
Then it's time.
definitely time to talk to your asthma doctor and look into mental health support.
We should also acknowledge sometimes there's stigma around mental health, depending on cultural background or community.
That's a really vital point. If you face unhelpful reactions, please know your feelings are valid. Seeking care for your mental and physical health is a sign of strength, not weakness. Resources are out there. Don't hesitate to look for them.
So the big takeaway here is that mental health and respiratory health are totally intertwined. Managing anxiety isn't just nice to have, it's critical for asthma control,
Exactly. It's all connected. You need that holistic view.
which leads perfectly into being proactive. Prioritizing mental health as part of asthma prevention, not just reacting when things get bad.
Yes. This is such an important mindset shift. Recognizing that mind-body connection works both ways. Stress and anxiety worsen asthma, yes, but living with asthma also impacts mental well-being. It can become a negative cycle.
And there are physical mechanisms behind this, right? How stress affects the body.
Absolutely. Chronic stress leads to more inflammation system-wide, and that directly aggravates asthma. Anxiety can make you hyperventilate, which can sometimes trigger an attack. And then there's the behavioral side. If you're feeling depressed or overwhelmed, you might be less likely to stick to your asthma routine, maybe forgetting your inhaler, skipping appointments.
So taking care of your mental health is actually a direct way to take care of your asthma. How can listeners proactively do that?
First, just being aware. Recognizing the signs of mental health struggles, poor sleep, feeling constantly on edge, losing interest in things. If you see those signs, reach out.
Don't ignore them.
Right. Then build stress management into your life. Mindfulness, meditation, finding enjoyable, asthma-friendly exercise, maybe journaling, whatever works for you.
Finding your tools.
Exactly. And lean on your support systems, friends, family, support groups like Asthma Friend, maybe a therapist. And ironically, sticking really well to your asthma plan can actually reduce anxiety because you feel more in control.
That makes sense.
And finally, basic self-care, good nutrition, enough sleep, making time for hobbies, it all builds mental resilience.
It really drives home that looking after your mind isn't separate. It's fundamental to managing asthma well.
Couldn't agree more. Mental well-being is just as vital as physical health for asthma control.
Okay, one more key area. Workplace stress. This feels like a hidden trigger for many people.
You're absolutely right. It's often underestimated, but the pressures of work deadlines, long hours, difficult colleagues, even just the office environment itself can significantly trigger both asthma and raise blood pressure.
How does that work physiologically? What's happening in the body?
Well, that constant work stress can keep cortisol levels high, fueling inflammation in the airways and contributing to hypertension, like we discussed.
Right.
Plus, think about how we breathe when stressed or often shallow breaths, maybe holding tension in the chest. Not good for asthma, and feeling like you lack control over your workload or environment. That fuels anxiety, which we know is bad news for both conditions.
And it's not just the mental stress, is it? The physical office can be a minefield too.
Definitely. Poorly maintained AC, maybe it's blasting cold air, colleagues wearing strong perfumes or using air fresheners. General indoor air quality might not be great. Even sitting for hours in stuffy meeting rooms can be a trigger.
We heard from someone in the asthma friend community who juggled managing asthma and high blood pressure while working a demanding job and building this community. They really stressed how important a supportive workplace was.
That personal insight is so valuable. It shows that workplace culture matters immensely. Understanding colleagues, having some flexibility, it makes a huge difference. It's not just about policies, it's about genuine support.
So for our listeners navigating this, what practical steps can they take at work?
Little things can add up. Taking short micro breaks, maybe using that Pomodoro timer technique just to step away, breathe, stretch, drink some water.
Good idea.
Keep your essentials handy, inhaler, water, maybe a healthy snack. And don't be afraid to speak up respectfully about your needs. Sensitivity to sense. Need better ventilation. It's okay to ask. Surprisingly, sometimes just tidying up your workspace can reduce that feeling of being overwhelmed. And simple breath awareness, like box breathing for a minute before a stressful call or meeting, can really help calm your system.
And what about employers? What can companies do?
They play a big role, offering flexible breaks, maybe being mindful about fragrances, ensuring good ventilation and clean AC systems, fostering a culture where people feel safe talking about health needs, both physical and mental. That's huge.
It sounds like managing your health at work isn't about being difficult. It's about self-preservation and ultimately being able to do your job well.
Absolutely. Understanding these triggers and using coping strategies protects your health and allows you to thrive professionally.
So wrapping up this deep dive, it's incredibly clear that managing asthma effectively means looking way beyond just the lungs. We've seen how hypertension, our city environments, anxiety, workplace stress, they're all deeply interconnected with our breathing.
Exactly. You really need that holistic view. You have to consider the physical symptoms, yes, but also these environmental and emotional factors. They matter a lot.
And we really want to encourage you, everyone listening in the Asthma Friend community, take a moment to think about what we've discussed. Which parts resonated? Which strategies might actually work for you?
Yeah, we hope this has given you some valuable insights and practical ideas. And remember, you're absolutely not alone in figuring this out. That's what the Asthma Friend community is here for.
Exactly. Please keep sharing your own experiences, connect with others in the community. And if you found this deep dive helpful, if you want more discussions like this,
Make sure you subscribe to the Asthma Friend podcast
yeah, because ultimately getting a handle on asthma is about understanding all these connections.
and taking those proactive steps so you can breathe easier and, live your life well.